First of all, thank you for giving us the opportunity. And are you okay with me taking this educational video and put it on internet?
Yes, I am.
Okay, now tell me, we did a 2-level OLIF minimal invasive fusion in November of last year, so about 4 or 5 months ago.
Correct.
Now, tell me about first, what were your symptoms before the surgery?
I had a lot of lower back pain were my symptoms, and I fought it for probably 9 to 10 years. In the last 2 years, it really got a lot worse, so I just had pain consistently. It was hard to sleep at night.
Up to, what was the pain up to?
Up to, I would say, 8 or 9 on the pain scale.
Okay.
And it was consistent every day, all the time, and it really started to affect kind of my activity and lifestyle.
And I understand we did enough conservative therapy, physical therapy, and other things that they did not help you.
Correct.
And finally, we did the surgery in a minimal invasive fashion in November. Now, tell me about the surgery, your experience in the surgery, how long you were in the hospital, how did the stay in the hospital go?
Yep, so the hospital stay was great. I got checked in the morning, had surgery, I think it was by 9:30 in the morning, was out of surgery by noon, and then actually in the hospital that day. I did spend the evening in the hospital, but I was up and walking about 4 hours after surgery, which I felt was very important to get up and get moving, and they encouraged that. And I spent one evening in the hospital and went home the next day, and just kept very, very active with walking and trying to get up every couple hours after the surgery just to move around and stay active, which I think really helped.
Excellent. Well, this is actually a very good outcome. But I understand we talked about that nerve irritation, risk of nerve irritation before the surgery, on the left side where we have to push the nerve to the side to get there. And you had that nerve irritation. Right. Tell us a little about that.
Yep, so after surgery, Dr. Bossi did say that we had to kind of move some of the nerves aside, so there would be some irritation. And I'd say about 2.5 to 3 weeks after the surgery is when I started to have some leg pain with the nerve pain kind of shooting down my left leg, which for a while there got to be quite painful, but I did call and get on some medication for some nerve pain to handle that, and I took that medication for 2 weeks, and I'd say the nerve pain lasted maybe a total of 3 to 3.5 weeks, and it was gone, and then I just have some numbness in my left big toe. Currently that's been getting better and better, so but no more pain after that.
Excellent. Now, what was that medication?
I'm trying to remember
was
the
it
name.
possibly Neurontin, gabapentin?
Gabapentin is what
exactly.
It was. Yep.
That works for this kind of nerve pain. It works very well. You had what we would call a classic nerve irritation from me pushing that nerve away, and usually within 4 to 8 weeks that goes away. In your case, even went away sooner. Now, how are you feeling now? How do you feel with the pain now?
I'm feeling actually. I've been so surprised at how well I am feeling, and even after surgery, I'd say 2 to 3 weeks after, I felt really, really good. Dr. Bossi didn't keep reminding me that, hey, we have to kind of pump the brakes here and don't be too active. Even though you're feeling good on the outside, the inside is still healing and setting up with the fusion there. So I was very careful with that, and I have to say I feel really, really, really good.
Excellent.
And I've been impressed.
Excellent. Thank you. Well, I want to show you as well, if you don't mind, I want to show you as well your films that go there. And we see here on the side image that actually the hardware, these are the screws, the white structures are the screws. And inside of between where the disc used to be, the bone is growing already after 5 months. My congratulations to you. You have a good healing possibility in your back. Here in the 5S1, there's a small gap, but this is actually pretty good. Usually the fusion happens within 9 months to 12 months, so you are a little ahead of the schedule. And in the front view, again, we see that the bone is growing through and through. In the 5S1, in the lower level, the bone is working its way up, but still pending. So this is overall a very good outcome, and I'm very happy for you, and thank you very much.
You bet, thank you.